that is Liza Eustace. She is Sector Head for Healthcare, Construction and Hospitality at Absa Corporate and Investment Banking. And with South Africa expecting a peak in COVID-19 infections in about September. I mean, that's, I think, the popular science right now. You would think that private healthcare would be coining it. Private healthcare would be booming, but share prices are reflecting a big drop in earnings. The reason is actually really, really interesting. Liza Eustace has been doing her research into this particular topic. Why are these big hospital groups in particular, Liza, losing revenue?
Good evening, Bruce, and good evening to the listeners. You're quite right. Ordinarily, you would think the healthcare sector should benefit from a health crisis, especially such as one as COVID-19. However, the largest impact that these hospitals are experiencing is as a result of the cancellation of elective surgeries, which can account up to 50 to 60% of the hospital revenue. So, in the absence of these surgeries, which generally account for a higher margin, as well as the inability to actually cut costs, which would be your nurses, largely, and the hospitals are feeling the pressure on their liquidity and some on their covenant levels.
I mean, like a hotel business, a hospital needs to keep beds occupied for as much time as possible. They've got some fixed overheads. They've got big, expensive hospitals and electricity to pay for. They've got staff numbers. They can't exactly lay off their staff and say, we'll give you a call if we get a couple of COVID cases. Okay. They've got to keep everybody on standby, don't they?
Well, absolutely. Without nurses, there's no one to treat the patients. And even, at occupancies of as low as 35%, ordinarily you would see in other sectors, as we have already, huge job losses and furloughs across the sectors. However, the healthcare companies need to keep the nurses on to prepare for the peak. But at the same time, Bruce, they are also incurring much larger costs in the procurement of PPE. And they've seen about 5 to 6 times increase in their PPE costs, not only from price increases, which have also been a different story to talk about, but also because of the volumes that they need. They estimate that in some hospitals, you can spend 500 Rand per person per patient on PPE, and this could be the norm going forward.
And this then adds to the problem that all of us face, particularly when it comes to private healthcare, and that is healthcare inflation. I mean, we look at what happens to our medical aid rates on an annual basis, and I see Discovery's got a big briefing on its expectations coming up tomorrow, but there are other healthcare schemes as well. And, when you're seeing your medical aid rates going up by twice the rate of inflation at this stage, as inflation looks to go possibly even negative, we're going to see big impact in terms of the cost of healthcare in South Africa, whether we're using it or not.
Yeah, absolutely. The medical aid funders have actually been quite supportive of the hospital sector, some pre-funding where they can. But I think what's going to be more pertinent going forward is what's left in people's pockets. Now, the growth of the private sector depends solely on the growth of private medical insurance. And in the absence of being able to be paid more because companies are earning less profits, what are South Africans going to do? I mean, it'll be their last cut, but certainly you might see many South Africans trading down in their hospital plans, which means that you're going to have an increase in sort of your network providers. And those hospitals that form part of the network, restricted network providers, will need to be very, very cost conscious. And those that are not focused on cost now are going to suffer even more than they are.
And there's also been a drop-off. And again, elective surgeries is one thing, but the self-inflicted injuries, the things that we do to ourselves, I mean, people still fall off ladders in their bathrooms and bash their heads, and that's, good revenue for hospitals. But things like car wrecks and, the stupid stuff is also, again, a big revenue generator for hospitals and for the emergency wards. And for so many of us, I mean, you've really got to be at risk of losing a limb to want to expose yourself to a waiting room in a doctor's surgery or a hospital right now.
Absolutely, and there's we've even seen A&Es, come to the banks for assistance in from a financial perspective, as they are feeling the pinch as well. And what we will start to see now is we will start to see an increase in the rate of infection, purely because of the relaxation of lockdown, but also because we're coming into winter. So the normal flu virus is going to be much more prevalent, as well as the fact that many of the surgeons are actually now starting to operate on what is called medically necessary time-sensitive procedures. And with the increase in infection and some increase in elective surgeries, we will see an increase in occupancies, and have already seen since March some of those occupancies increase across the private players.
Liza Eustace, thank you. She's Sector Head for Healthcare, Construction and Hospitality at Absa Corporate and Investment Banking. Angie Motshekga confirming this evening, the Minister for Basic Education, that the 1st of June is the planned start date for schools, starting, as they said a couple of weeks ago, grade 7 and 12 initially, plus small schools as well. Teachers expected to go back from the 25th of May so that they can be there to get trained, I suppose, to receive PPE clothing, whatever is required in order to make the schooling environment safe for your and my children. You don't want to be sending your kids into a festering petri dish. There just makes no sense in that. And the Department of Education taking this deadly seriously, and of course learning from global lessons. South Africa tops 16,433 COVID-19 confirmed cases.